Hello everyone, my name is Irini Agathagalo and I am one of the therapists here at Stabilis Treatment Centre. Today I'm going to talk to you about the cycle of addiction. What is addiction and how is addiction formed? So here at Stabilis, normally when I work with my patients within group therapy, I ask them, I say, when a person becomes addicted to a substance, it's because what they're addicted to is what the substance does for them. And no matter what substance that you use or how you use it or how often you use it, the reason you use it is because it does something for you. Now, all the patients have a different reason for using, and the substance does different things for them. Now, what do I mean by the substance does something for you? I ask my patients, why do you use drugs? Why do you use substances? And they always give me a reason. Some of the reasons are because it makes me feel happy, or because it helps me sleep, it gives me an appetite, it makes me the life of a party, or even that it improves their sex life. So in order for me to do today's presentation, I'm going to use the most common reason why people use substances is that it makes them feel happy. So many people start using substances because something maybe traumatic in their life may have happened to them and they become severely depressed and they can't handle their emotion. So once they start using a substance, in that time when they are intoxicated, they feel a lot better. Although that feeling is very unrealistic. So yes, I'm going to talk to you about I use a substance because it makes me feel happy. So that is the reason. So by doing that, or by talking about the fact that it makes you happy, I ask my patients, do you know what the happy hormone is called? What your body secretes to lift your mood? And some of them say serotonin and some of them say dopamine. And yes, they are very correct. But today I'm going to talk about the hormone dopamine. All right. So the substance makes me feel happy, secretion of dopamine, I feel happy. All right, so let's begin. All right, so I'm going to draw this line. All right, so I call that line the normal line. I don't like using that term, but just to put it in simple terms, we call that the normal line. Okay, so up here, I'm going to draw a happy face. And down here, I'm going to draw a sad face. So we want to be at the normal line, or also known as the hedonic set point. We want to be over here. So our mood to be normal, we want to alternate over here. We don't want any spike in mood, any spike, any drastic spike up or any drastic spike down is extremely dangerous. When we find some of our patients that are over here, their mood is over here, we say that they are depressed. Okay, so this can, a diagnosis can be given such as major depressive disorder. Okay, so as I say, being down there is extremely dangerous. This is normally when people start thinking about committing suicide. But equally so, being up there is also not a good thing. So this is normally where the people start asking me, but being too happy, how can that be dangerous? What we call that is a manic episode. And yes, being up there is equally as dangerous as being down there. So if you understand me correctly, any major spikes in mood, whether it is feeling sad, whether it is feeling happy, is very dangerous. As you can see, we want to alternate at the normal line or at the hedonic set point. Alright, so now I'm going to talk to you about where does addiction lie within all of this. Okay, so going back to dopamine or the happy hormone. We say that dopamine every day, naturally, your body secretes so much dopamine. Now remember, our brains are extremely intelligent, but it is very lazy. It will not work harder than what it's supposed to, in other words. So every day, naturally, your body will secrete so much dopamine at the normal line because it doesn't need to produce any more or any less. Remember, it is intelligent, but it is lazy. All right. So now, a normal person, if I could say, would secrete so much dopamine every day. But now an addict, once upon a time, introduced themselves to drugs. So what the drug does, and when the addict uses the drug, it does this, a major spike in mood. The substance that is used does this. Now remember I said, any spike in mood, drastic spike in mood, is very dangerous. And what we call this is the first high. When the person is intoxicated for the first time and they feel the effects for the first time of what the substance does for them. Now, what happens from there? Because the person doesn't always remain there. Eventually the substance does wear off. So the next day, remember I said your brain is very intelligent, but it is lazy. So your brain sees this happening and it says, but wait a second, why am I working so hard? I'm way above the normal line. So the next day, what it does is this. It secretes a little bit less dopamine. And this makes a person want to use even more. So the person will use the same drug, the same amount of drug, again. And this is what happens. As you can see, they're not as high or not as happy as they were the first time. But again, the cycle continues. Your brain still says, but wait a second, why am I working so hard? I'm way above the normal line. So the next day, it does this. It secretes even less dopamine. You see the cycle starting to form here. So again, now the fact that it is even lower, your body wants to use the substance even more. So the person uses the substance, but as you can see, it is not as high as the first time. And this is how the cycle of addiction is created, or how it starts. So as the person continues to use the substance, this is what happens. The next day, they use the substance. The next day, they use the substance. The next day, the day thereafter, so as you can see, the person needs to use the substance just to get out of bed in the morning. Many times my patient tells me, depending on how far they are within their addiction, my patients tell me that the first thing in the morning when I wake up, I go into a panic. And this is the reason why. I go into a panic because I'm thinking about where am I going to get my next substance? Where am I going to get my next fix? Because if they don't get it, they are in a state of major depression. Now, I always say what your substance gave you in the first place, eventually it'll rip it away from you completely. Your body forgets how to produce it naturally. In other words, your body forgets how to be happy. You need the substance to make you happy. Now that's a very sad thought, and many people within addiction or who are falling within addiction doesn't realize what is actually happening here. So now, what do we do from here? Many times when people reach this stage is when they realize that, hold on, I've actually got an addiction problem. And this is when they come to Stabilis and ask us for help, for rehabilitation, for substance abuse. So I'm going to mark over here, this represents coming to Stabilis. All right. So at Stabilis, we take away the substance. Of course, you cannot use it anymore. We have to start, and you have to start rehabilitating. We have to start teaching your body how to become happy again, all by itself, without having to have to use a substance. All right, so the first day or the first week at Stabilis, as our patients start to detox, is the difficult week. But of course, we have nurses on staff, doctors on staff, psychiatrists, psychologists, and social workers to help the patient get through this difficult time. We also put them on a detox regime to help them get through the withdrawals and the cravings. But after the first week, it goes a lot easier for the patient. So let's put it like this. Their first day at Stabilis looks like that. Why? Because we've taken away the substance. Then the patient sits and they struggle because they they fall into a state of depression. This is not normally when they come to me and we talk within therapy and we help them get through it. But what happens the next day is this. Your brain says, whoa, I am dangerously low. I am in a state of depression. So then it says, I need to start producing more dopamine, but slowly. So this is what it does. The next day is it starts to produce a little bit more dopamine. Right. Then it's still in a state of depression. It's still like, whoa, I'm feeling very bad. So the next day your brain says, I still need to produce more dopamine because I need to get to the normal line. So it does exactly that. The next day it produces more dopamine. And it produces more dopamine. Do you understand why we say each day gets a little bit easier? Although it's said so often and many people say it's such a cliche, we say it so often because it is so true. Every day, little by little, your body starts to recover. Your brain, your mind starts to recover. And this is how the cycle of addiction works and how the cycle of recovery works. Every day, you slowly start to get a little bit better up until your brain knows how to be happy again. It doesn't need the substance. It knows exactly what it needs to do in order to get back to the hedonic set point. In other words, it knows how to get back to normal again. You can feel happy and appreciate the small things in life without the substance. Now remember, going back to the cycle of addiction, we don't deny, yes, your substance or a substance does something for you. It does help you sleep. It does help you get an appetite, or it does make you feel better. But what it's making you feel is so dangerously unrealistic. And it may make you happy, but in the long run, as you can see, your brain forgets how to be happy naturally. It relies so much on the substance to be happy. But it doesn't mean that that is permanent. It doesn't mean that I will never be able to be happy all by myself again. We just need to remind your brain, listen, I can actually do this by myself. And then going to the stages of recovery. Yes, at the beginning it is very difficult, but each day, it gets better and it gets easier. I always say, and I use this quote, if you decide to become an addict, you give up everything for one thing. If you decide to recover and become a recovering addict, you give up one thing for everything. Normally when I say that, it has such an impact on my patients because they can relate. During their cycle of addiction, they've lost so much, loved ones, connections, work, whatever it may be. The substance takes so much. Now remember, you give up everything for just one thing in addiction. But within recovery, slowly but surely, you start to earn trust. Your loved ones come back. You get your children back. You get a nice job. Slowly but surely, you start to recover. Physically, emotionally, you slowly start to recover. All right. So there's a lot more to this. A lot. We can go very scientific. I refer to it as day by day. It can take a day, it can take a week, it can take a few months. But I just put it very simply just for you to formulate an understanding of what is recovery and what is addiction. Now remember, I only used the reason that the substance made me happy. Some people have multiple reasons, and this applies to everything. Aggression, my substance makes me calm. It also applies to my substance helps me sleep. Whatever the reason may be, this diagram applies. All right, now remember, I only spoke about happiness and sadness. So I hope my explanation, an example that I drew in the board, helps you understand how addiction forms and how your brain is almost tricked into thinking, but I need it to be happy. We need to teach your brain again that no, you don't. You can do it naturally. And when a recovering addict gets to that point, that is one of the most beautiful things that you can see. They are happy for the smallest things in life. They appreciate the smallest things. They are around their families and they are so loved. And that's normally when they come to Stabilis and then they tell us, thank you so much, I finally got my life back. I always tell my patients that an addict creates two people. It creates the addict, say now I'm an addict. It creates an addict, and then there's Irini. There's me, and then there's the addict. The addict will do things that Irini would never do. So I tell my patient, normally we see the addict walk into Stabilis. And then we see the patient or Irini walk out. And it is such a beautiful sight. Every day I see my patients physically, emotionally get stronger and stronger. And you can see such an improvement. And this is daily, every day I see my patients going from severely depressed to happy. Purely and utterly happy. And that is one of the most beautiful things for me as a therapist to see. So after seeing this, if you think you are spiraling down into a state of addiction, if you think that you are on this side and slowly but surely the substance is taken over, you don't necessarily have to be here to realize that you have a problem. You can even be over there. If you realize that you have a problem, please contact us and ask how we can help. Come to Stabilis. It is never too late. As I say, we have a full multidisciplinary staff that is here to help you and to help your family. Anybody can kick addiction as long as you want to get better. Okay, everybody, I hope I've given you a good understanding of what addiction looks like and what recovery looks like. Yes, if there's any further questions or anything that you would like to know, as I said, please do not hesitate to contact us. I look forward to seeing you and have a lovely week further. Remember, please like us on all our social media platforms. We post a video such as this every week, and you can see it on YouTube, and we also share it on Facebook. All right. Thank you, everybody, and until next time. Bye.